There we go. I wonder if they can hear that message at the same time as we can. Do you think they do?
We're in listen only mode.
Yes. Hi, guys. Welcome. Good morning. Thank you so much for being here, taking time out of your already busy schedule. I know our phones have been blowing up. It feels like AEP time already.
AEP is coming to town.
Yes, it is. Yes, it is. And it feels that way. So thank you so much for taking time out of your day to spend just a little bit with us here today to talk about how you can use that scope of appointment, that pesky scope of appointment, to your advantage to cross-sell. Yes, so thanks so much. Today will be a shorter webinar just because it is that time of year. And also, we're not going to be diving in too much about why to cross-sell today. We're going into this as you understand the reasons of why to cross-sell. This is how you do it. This is how you connect it. If you need more information, if you need more context, if you need more reasoning as to why to cross-sell, we have plenty of resources on that today, this year, more than ever, because people are figuring out ways to make up for lost income with those PDP commissions, with people moving off of med subs, all that sorts of stuff. So, but yes, today we're going to be focusing specifically on that scope of appointment, how to use it as a sales tool. First things first, my name is Sadie Palmer. I'm the team leader of training and education.
And I'm Clayton Clemens. I'm a member of our agent resources team, and I head up our CARE initiative.
Yes, which is obviously, well, tell them what CARE is, so that way they.
So super quick, I won't get too sappy with it, but you guys know me, you know I love cancer insurance, and CARE is cancer insurance awareness, resources, and education. So when she's saying we've got a ton of tools to help with cross-selling, my team focuses specifically on cancer insurance, but I have made a cross-selling and extra products kind of like my wheelhouse. Like I love talking about them, which is why I'm here today.
Yeah, exactly. Yes, he heads up that CARE team, but he kind of, you're my go-to for all ancillary product stuff. You're always the person I go to if I ever have any questions. So he's the right person to be here with me here today.
I love when Sadie says nice things about me.
And it's recorded. Speaking of which, today will be recorded. We will have a follow-up email that will go out after this later today that has the recording in it. Of course, you can always find our recordings on our YouTube page, so please be checking there. If you have to hop off, that's totally fine. We have that recording for you and that follow-up email. Also, please feel free to use that Q&A box. It makes our job a lot more fun, and you guys get a lot more out of it. There's no stupid questions. Only we can see your questions, so please feel free to throw them in the questionnaire box if you have any. And then also, we're going to be talking about different scopes of appointments today, different tools, all that sorts of stuff. Just to let you guys know, a lot of these things that we're referencing are going to be on our AEP toolkit that is on our website. So if you are contracted with us, surely you already know about the AEP toolkit. If not, go ahead and check it out or give us a call. We'd love to give you a walkthrough. So just keep that in mind. That is where you can find it. It is on our homepage. But
I do want to resell that YouTube page. There's been a ton of good webinars recently, and I know everyone's really busy. So if you weren't able to attend some of these webinars, check out that. There was a really good Ask Me Anything with some of the industry leaders that we did recently.
Yes, so good.
Check that one out.
So good, yes. All right, guys, we're going to try to keep this short and sweet for you today because we want to be respectful of your time. Oh, I'm already recording. Oh, look at that, already on top of it. So let's go ahead and dive into it. First things first, let's go ahead and just talk about what a scope of appointment is, just as a refresher, and then also some of the rules around it, just because there's been some changes in the past few years. So first things first, scope of appointment is a necessary document that must be signed by the client and yourself as well before you can talk about anything Part C or anything Part D. A lot of times people are like, oh, well, we'll figure out the scope later. We'll do this, we'll do that, it's whatever. Scope is very, very important for you to sign. It is essentially what it is it is a document saying, hi, I'm the client and I am giving you permission to talk about this, just because there have been some nasty things in the industries and insurance industry where people are getting signed up, just combating all that sort of stuff, call center stuff like that. So scope appointment, you guys know what that is.
It's just getting everybody on the same page that we're going to have a conversation and I'm going to try to sell you a Medicare Advantage or prescription drug plan.
Now, one key thing to remember here today, this is an important point, but an important point here today. Once you sign that scope of appointment for that appointment, you are limited to what was the products mentioned on the scope of appointment. So once you cross the scope bridge, you are stuck. That was not a super positive word to use, but you are stuck having to use or talk about those products that are there on the scope. Now, the 48-hour rule, I'm yapping too much. Do you want to talk about this 48-hour
rule? So 48-hour rule, it's back still here. So a lot of you are already familiar with this from the last couple years now. And going forward, you have to wait 48 hours from the time of that scope appointment signed. So if you're doing it digitally, there's a timestamp. You got to wait exactly 48 hours after so you can have that appointment with the client. If you're doing a paper application, there's a little bit more wiggle room, but I'd stay pretty close to when that 48 hours is up. This is just to allow the client, because it's a pain, right? We have to wait 48 hours. There's a couple exceptions I'll go over in a second, but it's designed again to protect the client. Just like the scope of appointment in general, it's giving the client a little bit more opportunities to back away from this sale.
Yeah.
So the pushy salesman that got them to sign the SOA, got them to a scheduled appointment, they have 48 hours to be like, I don't have to answer that phone call, or I don't have to show up there.
Right.
It gives them a little chance to breathe. Now, the couple exceptions would be if they're in the last 4 days of the SEP. Not 4 days of the month, but last 4 days of the SEP. So looking at AEP coming up, those last 4 days, you do not have to wait the 48 hours. They will be able to sign the scope of appointment still and have that appointment same day. The other opportunity to waive that 48 hours is a true walk-in. And I always use that wording, true walk-in, because what we don't want to happen, just because letter of the law would say, some client calls you and says, hey, I need to set an appointment with you. And you're like, well, I got some time today if you want to come in. That's telling that client, your appointment's today, come in. That won't let you get around the 48-hour rule. But let's say you have an office front, somebody sees the sign and walks in and says, you know what, I really need to talk about my MA. I've got 30 minutes before my next thing. Can you talk with me about it? That's a true walk-in. So just wanted to break that down a little bit deeper there.
We've had some people, of course, there's a million rules that we have to follow. So it totally makes sense as an agent, you're just trying to help people. What are some workarounds that we have? I know that people have asked, well, can we, what if we have someone walk in sort of situation? Just keep in mind that because of a lot of compliance rules that have been added in the last couple of years, there has been an up in both carrier and also CMS secret shoppers. Yeah. So keep that in mind. They also are secret shopping over the phone. So just keep that in mind. You can be audited at any time. Nobody thinks that it's going to happen to them until it does. So just keep that in mind. Try to, keep that as ethical as possible there. Terry, you have a really good question. Does SMS have a scope of appointment that lists cancer? We will get to that. We will talk about that in just a second.
Coming soon, but spoiler alert.
Yes, spoiler alert. Yeah. Okay, guys, let's go ahead and get into the bulk of what this webinar really is about. One thing that we've kind of been saying, one thing that we've been relating to you on is that the scope of appointment is mainly seen as just an absolute hassle. It is another roadblock for you to be able to help your clients. It is just another thing in your way to be able to do your job. And with a job like this, there's a lot of things that come with it, but the scope of appointment just seems extra pesky because it has to be signed every single time. But today, we want to help kind of change your perspective on what the scope of appointment can be for you. Right. It is something that can be a roadblock, or it can also be something, or two things can be true at once. It can also be a tool that can help you transition, help you bring up products without feeling too salesy or anything like that. Today, we want to change your perspective on the scope of appointment. And the number one thing here is the scope of appointment can be a sales tool for you. So like we said, it's all about perspective. And the key to this as well is, one, changing your perspective on, okay, this is a tool that I'm going to use rather than this is a nuisance. And then communicating. Sometimes we fall in the habit of, okay, here's a scope of appointment, and you're with your client, it's a necessary evil, what. Also communicating to your client, changing that perspective on how you communicate it as well. That way they see it as a helpful document and a little less as you know, a pain in the butt the way that we all do. So just keep that in mind. So let's dive into it. Okay, first things first. The scope of appointment is such an easy way to bring up these extra ancillary products, because you have the cop out, if you will, of having to have this form right in front of them signed that says, these are products that the government recommends we talk about. This is a CMS file, this is a CMS proof file, and these are different products that they are recommending. So right off the bat, that kind of lowers the guard, kind of puts, is a scapegoat, kind of puts that fear of feeling too salesy, too pushy right on top of, you know, someone else.
Exactly. And my thoughts on this is, and remember, the chat is just for us. We can see that. I want to know, just of you all out there, you have the scope of appointment, they've checked all the boxes. How many of you aren't talking about the other products? You're just there for the MA appointment, even though they've checked all the boxes. Let me know. I'm just curious, because I bet there's a lot of opportunity that's sitting on that piece of paper, and that's why we're here today, that we want to talk about those products. Because you could say, you know, hey, we saw that you checked this. I want to make sure we're talking about this since you signed it on the scope of appointment.
Yeah, honestly.
And you go, you signed it, you talk about it.
Yeah, yeah, exactly. Again, today's not about like why to cross sell, but that just made me like think of a perspective that I never really had. If you aren't cross selling, imagine having to have this paper signed every time. Every scope has dental, vision, hearing, and hospital indemnity on it. So make sure you're at least offering those products, because those are products that you're putting in front of people saying, hey, the government is recommending that we talk about these products. And if you don't sell those, yikes. You know, they're like, oh, you can't help me with that. Well, then it makes it a little less, you know, like of a sales tool for you there.
For sure.
One thing that I love about the scope of appointment and using it more as a sales tool is people love to know what they can expect.
Yeah.
We talk about this a lot whenever we talk about our 8-step selling process. We talk about how it's so important to have a process, and one reason is because people know every time they come into your office, they know exactly what's going to happen. People find comfort in knowing what to expect. So whenever you have that scope of appointment, it also allows you to show products without having to bring them up. That way they know, hey, we're going to talk about these core products, but there are also products here that we can talk about a little bit later. It shows people, I think one issue that people have with cross-selling is, whether they do it or not, is I never know how to do it without feeling like I'm pushing these extra products on people.
For sure.
And there's a few ways to kind of combat that, but this is a really simple way, in the sense of the scope of appointment, that important document that they have to sign, it brings it up for you. It kind of, you know, does the work for you, and you don't have to be like, what about this? What about that? It kind of brings it up for you.
For sure. And I think that leads us into our next topic pretty good here, is the carriers have pre-designed these products to fit with these other core products. And we'll talk more in a little bit more detail a little bit later here. But like a hospital indemnity plan, like they are designed to work well with their MA product. A MedSup doesn't offer dental. Here are two products that are both on the scopes as cross-selling that are attached perfectly to these core products and how they would function. So having that easy barrier of entry that we're talking about, your MedSup and your PDP today, and you check dental, okay, you can see like you checked hospital indemnity and MA, but we know what we're here for. And you can, you know, hospital indemnity not gonna really work for you that well. It could potentially, but what I want to focus on is the coverage you don't have is dental. What is your plans for this? So we'll kind of talk about that, like I said, a bit later, which I think I'll just hit that because I just did that.
Sure.
But the other products, so Terry had a good question about asking, is there scope appointments that still list cancer? How they list that would be, we'll look at the actual example here in a second, but looking at other ancillary products, because some of them are worded that way. And that will open the door to a lot, and I'll still recommend staying away from a couple. I'll show the example here in a minute though.
Yes. So kind of transitioning into that, you have to keep in mind that not all scopes are equal. You guys know this. As far as, I guess I should say, clarify on this, what products you can offer. So just because one scope of appointment says, hey, you can offer other ancillary, you have to use the scope of appointment that says other ancillary. Again, it's letting them know, it's letting their clients, it's keeping their clients safe, but it's also keeping you safe as well by saying, no, they signed this, saying that we can talk about this. So we're going to dive into example of how not all scopes are exactly equal. Clayton, you can go ahead and talk about this.
You'll see the two examples here. Medicare Center is the one I want to talk about first. So top left here. Excuse me, y'all. So there's different products that are on here, and it's going to be the norm. Part C, Part D, Medicare supplements. Where this one's built a little different is that checkbox of ancillary products. That opens a big old door for us, because let's go ahead and look over at UHC, and then I'll compare the two for you guys. UHC, same idea, C, D, MedSup, and the two ancillary products they list is what Sadie's been talking about this whole time: dental, hospital indemnity. This is great. We love this. They pair well, easy mix. However, we're limited to what we can do in that appointment still. So ancillary products opens a big old array, right? I would still recommend staying away from the financial products. So annuity, life insurance, cancer insurance is one that is normally considered financial product. However, this ancillary product gives us enough leeway to tie it into a health product, since it's at the end of the day more of a health product, where life insurance or annuity is strictly money, right? It's just for this. It's not anything to do with your health. It's final expenses, the lack of health anymore, right? Like that's when you're going to get your financial gains from. So that is a financial product. Now, how this would work is other products to think about that we don't necessarily tie in perfectly, because we could say, okay, cool, I can also add cancer insurance to this, but other than that, I'm just getting hospital indemnity, dental, and vision, right? So there's not as much as you think. However, if we're going through an MA scope of appointment, or not scope of appointment, summary of benefits, we're seeing other areas that could need filling, right? So we're looking at, well, what's it look like when they go to a skilled nursing facility? So can I talk to them about either a short-term care plan, or maybe would they rather recover at home with their home health care plan? So there are two other products that you could talk about. When you're also going through those, you're seeing different ability to add riders. You can look at their ambulance coverage. You can look at different things like dental and vision, because the benefits, like we know, have taken a little bit of a hit this year for the MA products. Dental is one of those areas that we're seeing take another step back. However, that could still be enough for that client. But you want to talk about, hey, I don't know what these benefits are going to change to next year, because this is a yearly contract. We've seen them take a step back. I can get you on a dental plan that we know what the benefits are going to be next year. We know how it's going to work. And if I'm getting you on this now, the benefits grow in the further years, where they're not going to shrink. So I want to get you on a product that will set you up for the future for your dental health.
That's exactly right.
So it's not a perfect fit because they offer it, but a MedSup client, it's a perfect fit, right? There's no dental coverage. Okay, did you have it? Let's talk about it.
Exactly.
So using these two scope of appointments gives you that option to talk about it. And like Sadie discussed, was if they're checking the box, they want to talk about it, or you're being told you need to be discussing it. Now, a MedAdvantage client, you're talking about a MedSup, you know they're not going to want to go that way. I would have that discussion still with them. Be like, hey, I noticed that you checked the Medigap section of your scope of appointment. Is that something you're interested in looking at switching back to? You know, we were not in an open enrollment time for that. We'd have to go through some underwriting. However, if that's something you want to discuss, and they could be like, oh no, I just checked all of those boxes. And be like, okay, cool. I just want to do my due diligence. Let's move on to the next one. Part D, that would attach to your MedAdvantage plan. So we're good there since you're not going the Medigap route. However, I did want to discuss the ancillary products box you checked, because this is a big thing for me. I want to make sure that you're protected and walk out of my office with the best coverage you could possibly have. So you're just showing them that, hey, you know, like, I'm not trying to sell you these other two. You're good. I'm not going to switch you just because you checked a box. This one's important. And showing the importance of, they might not even understood, like you said, or like I said, you said it probably at some point.
We said it.
We said it together. But they've checked these boxes just because they're in the habit of check. Okay, cool, we can do this. Or you've coached them to say, just check all the boxes so we can talk about anything that we need to in that appointment. Because you don't want to be limited. If somebody doesn't check an ancillary box, then you can't talk about hospital indemnity. You can't talk about cancer. You can't talk about all these other products we've mentioned. It really ties your hand. So continue to coach them to check all the boxes, but tell them why it's important that they check those boxes. Make sure that they understand how their product works and how it doesn't work. That's the key of using this to your advantage.
Yeah.
The ancillary products fill how those products don't work.
Right.
They fill these little gaps. We need to make sure that you're protected.
Correct. Okay, Michael has a question. Can you have a standalone dental with an MA plan that has dental? Really good question. Actually, our last slide that we have here is going to be talking about how these things fit together. So, hospital indemnity is the first thing.
What a transition. This is working really good on transition today, guys. I love it. So, selling off the scope. I think I hammered home hospital indemnity pretty good. However, I want to give you guys one more little nugget here of how to utilize the scope of appointment and all the other stuff you got to do during this MA appointment, right? We see the pre-enrollment checklist. We know what we have to do. We have to talk about summary of benefits. We have to do yada, yada, yada. So let's use it. Let's use that other tools. Scope of appointment gives the opportunity to have the opportunity to discuss this.
Right.
The summary of benefits locks it in. The summary of benefits that you're going to be reading through those clients, or you're just looking at plan details. Let's say you're on Medicare Center. You're scrolling through, you say, okay, yeah, you see here your max out of pocket's this. We're going to go down a little bit. And usually one of the first things you all see, and correct me if I'm wrong, because I would love to be wrong on this one, but at the top, I always see inpatient hospital copay. That's one of the first bullet points that gets brought up. And we both know that multiplication is not my strong suit. However, when you're putting a big number together, like, okay, you're going to be in the hospital for 5 or 6 days, you're going to pay $300 a day. Somebody math me really quick. That's lots of money, right?
Sure.
That's a quick way to that max out of pocket. And that's how I would communicate it with the client is, hey, I want to talk about this inpatient hospital copay, because that's going to be a quick way we get to that max out of pocket. Now, I do have a product that can help take care of that. It's hospital indemnity, which is one that you checked on the scope of appointment. So remind me, let's circle back after we get through the summary benefits and let's discuss that further. That opens the door for them to ask more questions right now, because they say, wait, that number does scare me, let's discuss that. Or they say, okay, cool. And whether they remind you or not, just like, oh yeah, okay, so I wanted you to remind me, I remembered. Let's discuss hospital indemnity. That's the last thing we got here on the scope of appointment that we need to discuss. And if you keep going back to like, it's on the scope, that's what we're here, this is your appointment, is based off of this scope of appointment.
Right.
You're telling them, you did this, I'm doing my job, I want to make sure we're discussing these things.
Yes.
Fits perfect, guys. Next, dental vision hearing. So thank you, Michael. This is a great question. Yes, you can have a dental product and a Medicare Advantage product. What you can't do is bill the same service to both. So you would basically be picking which one that you're going with. Are you using, let's just throw out United Healthcare's dental, or are you using Manhattan's dental? You won't be able to bill the same service twice. So UHC might say, we'll cover up to this amount of dollars, whatever, right? But Manhattan says we cover this percentage. You can't take that remaining percentage, like let's say we cover 40% of this. I'm making stuff up. We cover 40% of this. You can't say, okay, well, I'm going to take that 60% and use my UHC dollars, 0% covered by me.
Right.
It sounds great, but it is one of those things that's too good to be true. So that service would only be able to be built once. And like I said, a lot of the times those MA clients are going to feel comfortable with that benefit they're given. However, especially if their MA plan looks great and dental was an area they took a hit, I would lean on the stability is not there. We're watching these changes happening.
Yeah.
I want to set you up on something that we know every year what your dental coverage is going to look like, and it will get better over time. Here's how. And then you dive into the benefits of the plan. And you're saying This MA is focused on your health. I agree with you that dental should be included in part of that health coverage, but for whatever reason, it's not. So here's a little benefit over here, but let's really make sure you're covered because, you know, we got you on the $0 premium plan. We can keep your health budget low and still get you some more dental coverage.
Yeah, well, like you said earlier, you have to keep in mind a lot of times MA plans do have that dental on there. So we think of DVH as more of a med sup sort of pairing. And of course it is, but you have to keep in mind that this year benefits are changing. We don't know how it's going to be year to year, like he's talking about that stability. This year, money is the budgets are being worked around on MA plans. We'll see how it will work out. But because dental is some of the like newer things that people have been funding in their, or that carriers have been funding into their plans, it's probably going to be one of the first things to get benefits taken away from it. Not saying that it'll completely go away, but if someone has been used to having really good dental coverage, or they're used to having really good coverage for their hearing aids or for their glasses, that might be an issue for them, might make them pretty uncomfortable to see on their, you know, ANOX that maybe that's not covered as well this year. So keep that in mind. This year, dental and Medicare Advantage plans could play out to be a pretty good pairing as well.
Yeah, and really looking at just what the client's wanting out of that. It's not going to be a slam dunk for everybody.
Sure.
But you want to discuss that and say like, hey, like you've got what I believe to be the best fit for you for Medicare Advantage. However, this did take a hit, and I know that's important to you. And we also know in the background here at the FMO level, and then we try to communicate that to you guys, is that dental is one of the top reasons people were shifting MA plans. They would move around based off of that. Going forward, that's not going to be as big of a deal because there are so many areas that are either inflating or shrinking. So we want to look at other products that we can put. And also, guys, I didn't even mention this yet, having additional products with them will give you a permission to contact them in years to come.
True.
No matter if some telesales guy says, hey, switch to this plan, and say, all right, why not? And then they're gone from your book. Then you have to reestablish permission to contact unless you have one of these products, another product attached to them. We got another question here.
Where's the mouse?
I lost it.
Ah,
there it is. Michael, if client wants/needs a PDP, who do you recommend this year? Let me circle back to that. PDP market.
Yeah. Yeah.
Other ancillary products. I will get to that. I promise you guys. Hang around to the end. So selling off the scope for ancillary products. This is something where I will not ever stop telling you sell cancer insurance. Everybody needs it. It's going to work for both. And I've told you guys a million times why. So go back to that YouTube page, watch some of those videos, check out the care page to talk about more with just cancer insurance. But I want to discuss of how these all work with different things. So let me give you a real life example of another ancillary product that would work for MA or MedSup. So like a home health care or skilled nursing. Right now, my dad got pneumonia, went to the hospital. He was okay, he's doing fine. Thank you guys for asking in your heads already. But with him, he's 74 years old, so he's going through a bit of a recovery as far as just, it's been hard on him from sitting in the bed. He needs to get his PT going. They sent him over to a skilled nursing facility that will cover him for the first 20 days. He's on, I believe, a high deductible MedSup. HIPAA, forgive me if I'm giving away too many things. It's my father. I love him dearly. So with this, he's able to go to that. But if he wanted to and was able to, and I know he would rather be at home recovering, he just doesn't listen to his son who has told him that he needs these other products to say, let's go recover at home, Dad. Let's have that person come to the house to help take care of you so you can be comfortable after spending that week or two in the hospital. I just wanted to throw that example out there for you because it's one of those, come on, Dad. I've told him about hospital indemnity, even though he's on a Medicare supplement plan. I said, Dad, you're on a high deductible plan though? Like, that's how we're gonna get to that deductible, right? We could get you that same money and you're still in a GI window. Like, you have options to get on this, even though he's not in the best health. So I wanted to make that kind of a real situation of looking at all of the other products And I will say cancer one more time, because no matter if you're on an MA or Med Sup, it's going to work out for them. The Medicare Advantage plan summary benefits, you'll get similar to how we did hospital indemnity, like, hey, that's a quick way, we'll get to that MOOP. You get to the cancer part where it's talking about chemotherapy and radiation, and it's usually that 80-20 split. You can say, now this is truly the fastest way, where if you were to come down with this diagnosis, we are gonna hit that max out of pocket.
Right, very quickly.
And unfortunately, cancer doesn't care about the time of the year or your deductibles at all, or your max out of pockets. Let's say it starts in November. Guess what's gonna happen again in January, because you're still gonna be going through treatment more than likely.
Right.
We're gonna hit that again. So I just want to talk about options that could help take care of this for you, and I'll get off that.
Yeah.
But there's
Well,
a lot of products that are out there that will be beneficial for this.
absolutely. And this is the dude to talk to. Guys, that's what we have for you today. Please feel free to throw those questions in there. Otherwise, we'll get out of here. Michael, we will answer your question here. We wanted to keep this short and sweet for you guys here today. So if you have any questions, please feel free to call us on this number. Go to our website, smsteam.net. That's going to have a live chat as well as the a generic scope on the AEP toolkit and lots of other stuff. And then SMS-University, I didn't put .com, but .com is
Dealer's
on there.
choice.
Yes, exactly. Or you can just click the training tab on our website, and you can find more training on these ancillary products and whatnot. But yeah, throw your questions in the chat. Otherwise, we'll get out of here. But Michael, let's review what he said here. If a client wants/needs a PDP, who do you recommend this year? Loaded question.
So PDP market, I had this conversation as fast as I possibly could in 4 minutes. Let's see if I can do it faster. PDPs are wild this year. We can't afford to be chasing PDP business. So I want to make sure that's my first point, because we know what WellCare and Aetna are doing. No commissions on new business. WellCare saying no commissions on renewals. Aetna says, sure, we'll pay you on renewals, but anyone that's on SilverScript is getting mapped over to this choice plan. So let's say you've got a PDP client that's on that $13, $17 plan, somewhere in there. Forgive me, I can't remember the name off the top of my head here, but they're getting mapped to the choice plan, which is about a $40-ish PDP premium. So they're not gonna be super happy about that. So we're looking at who's next up in that WellCare vein that will pay me something on PDP commissions. Cigna is paying partial commissions on their Cigna Healthcare Saver RX plan. That is going to be a nationwide premium of around $16-ish. So that really says that's going to be who's next of someone that will pay you something. What I don't want to see with this, guys, is spitefully moving $0 PDP premiums to a Cigna block that will pay you something, because one, it's going to eat up a lot of your time. Two, it's not going to make you a ton of money. But I understand the frustrations and that kind of thought process, like, let me just move them off of this. Let's get on to something. And that could be beneficial for some people, because that $0 PDP premium with WellCare is still around. So we got to look at where it's going to fit, what we can do, and what else that we can help that client with.
Yeah.
So mention those ones: Anthem, United Healthcare. United Healthcare looks like they really care about PDPs again. I've seen price decreases in some areas, which if you would have told me that a couple months ago, I've been like,
a couple weeks ago.
Yeah. You're high.
Yeah.
So let's go look at Anthem, United Healthcare, Humana, Cigna. Those carriers have said if it was commissionable in 24, will be commissionable again. And they all kind of fall into that same bucket. It's going to come down to formularies, but they're all $30 to $50-ish. And they might have a plan that's a lot more expensive that's got even more rich benefits with that formulary. So that was like 2.5 minutes. Take what you will from that. However, go to the YouTube page. I'm going to keep plugging it because there's been some really good stuff here.
Yeah.
There's a video that we did on the 2025 PDP market. Is it worth it? What do I do? How do I make my best of this? And I believe they covered it in that Ask Me Anything as well.
They did as well. And we just did, we've been getting a lot of questions because PDP and the agents are worried about how can I make up for that lost income, all that sorts of stuff. PDP is definitely going to be something that is going to help you this year, is going to help you play the long game. You're not making commissions off of it now, but it's just another product that they have with you. And it's also, you know, a necessary thing. And so people are trying to figure out how can I still do all that PDP, not screw over my clients by not doing it, but also make up for that lost income. That was a long way of saying on our YouTube page, we also have a webinar with Retirement Realized, who is our annuities partner. So if you want to look into that, adding that extra income, and then of course, cross-selling is really going to help you as well this year. Hopefully you got some good tips taken away here today, kind of change your perspective a bit on the scope of appointment, but cross-selling is going to be very, very important this year.
Yeah.
So make sure that you're setting those follow-up appointments after AEP, because you probably won't have, you might have time to do some cross-selling, but for most people might not. So just keep that in mind. There's plenty of ways. Obviously, our whole business here is making sure that we're helping you guys. If you don't make money, we don't make money either. And so we want to make sure that we are helping you. If you guys have questions about PDP, if you have questions about how to cross-sell this AEP, all that sorts of stuff, we have the resources, we have the knowledge, we have all of it. We've had the conversations a million times. We'll have it another million if that's what it takes. So give us a call.
Let me put a little bow on this and we'll get out of here. So we've talked about how to use the scope of appointment as a tool to cross-sell. And we're looking at, okay, I also have this PDP block that I don't know what to do with. I don't know where I'm going to make this commissions with. And like I said, like, you can't afford to chase it. If we're cross-selling a percentage of those people, of the PDP or of your MA, doesn't really matter, those commissions will add up quite a bit quicker than the PDP for the kind of general speaking. So be looking at that, be looking at those opportunities, give us a call so we can help you do the math to see what numbers you need to do to hit those goals that you have. Talk to your upline, whoever that might be. So I want you to know that there are other ways to go out there versus chasing PDP business. And those partners over at Annuity Realize are going to be a great, great fit for you guys. Olivia said it really good in a meeting I was just in before this webinar, as you guys know how passionate and how much I love talking about cancer insurance. Caleb and those guys over at Retirement Realize, they're the care team for annuities. They love this stuff. They care about it. They understand how important it is for a client to have this kind of protection. And it's going to be a big, big addition to your all's agency. Just watch those numbers grow.
Absolutely. Okay, guys, thank you so much for joining us here today. Honestly, I feel like we made pretty good time.
Good time.
Yeah, good time.
If we're talking ancillary products, I could be here for 2 hours.
That's exactly right. That's exactly right. Terry, let's see. In California, we're not allowed to sell cancer after 65. So I'm trying to mention that to anyone I meet that's 64. Love.
Super great point.
Yep.
Terry, I know we've discussed this before, but in California, they've got weird rules that won't let you do it past 65. So that gives you great inroad to get that permission to contact early with them, sign them up, and their plan's cheaper the younger they are.
True. Cool, guys. Thank you so much for joining us. Of course, give us a call, live chat us, text us if you have our numbers. We want to help you guys out with anything that we possibly can. So thank you so much for joining us. Clayton, thanks for being on.
Thank you.
Cool. Thanks, guys.
See ya.